go through a case example of a really interesting story and someone I'm super proud of. So this person's absolutely awesome. She was going through a couple years of dizziness after a day-long period of painting with her neck in a really funky position looking overhead. And since then, she had been dealing with tons of dizziness, unable to really figure out what to do because any type of movement or exercise was making it a ton worse. What we had to do was restore the way her neck functioned and be really gentle while we stretched the right things, strengthened the right things, mobilized the right things, and returned her neck to feeling good. And we integrated her balance systems to make sure she wasn't too dependent on her vision, for example. After doing all that, she's been able to return to working out at her house, doing housework, yard work, everything she wants to do. Still some room to grow towards her goals, but I'm super happy. She's worked super hard, had faith in the process, and shows you that even if you've been dealing with this for a long time, you can really make incredible progress once you start to get a couple things going the right way. Go through this case example together. I'm really excited about this one. So let's call this person Abby. She had been dealing with chronic neck pain and headaches almost every day for about 2 years, and she had tried a lot of things. She's been to chiropractors, acupuncturists, physical therapists, medical doctors, had the imaging, had the test. Everything is normal, or someone thinks it can help, but it can't. Needless to say, she was really frustrated and it was weighing on her a lot mentally, which makes sense. It had been 2 years and it was really affecting the quality of her life. Couldn't really work out, was struggling to make it through the workday without pain. That's gonna affect everybody's mental health. What did we do to fix it? Really worked on restoring the way her neck was holding itself and moving, the way it functioned. She responded well to some repetitive motion, so there was a little more complex stuff that we worked on. We really focused too on some breathwork activities and some ways to reduce stress throughout the day to help kind of tamp down that sympathetic drive that can happen when we're in pain for a while. I really want to stress that nothing we did was like crazy magic secret stuff. It's doable for everybody. Time to dive in and go through a patient case example. This review is from a patient we'll call Amanda. When I met her, she had been dealing with headaches, neck pain, and dizziness for the past couple of months that had really been messing with her quality of life. She had had all the medical tests, been to chiropractic, which actually seemed to make it worse, and she was getting really frustrated. This past weekend, she just went to a 3-day music festival and felt great. So how did we get there? On her first evaluation, it became pretty clear that she was over chin tucking when she was thinking about trying to sit in a good posture. She knew she had neck pain, dizziness, headaches with over slumping, but the way she was correcting it was a little bit abnormal. It was causing a ton of tension and irritation in her suboccipital area. Really, once we fixed this, the tension and headaches started to really come down. Then we integrated her balance systems and got her back to doing things in the gym, feeling confident going out and hanging out with friends, doing more social situations as well. And it worked, right? You can see here she was able to get back to doing the things she loves. We're still working on getting stronger. We've got a lot of ways where we can make progress, but she's able to do some pretty amazing stuff in a relatively short amount of time. Let's go through this patient case. Dealing with neck pain, being dizzy, having headaches, it can be really scary, especially when you're hearing, hey, you may need surgery. This review is from a patient we'll call DG. And as you can see, he was told he was gonna need surgery as kind of a last resort to some pain that he had had for decades. It had become really frustrating and scary because he had tried physical therapy, tried this, tried that, tried chiropractic, and hadn't really been able to get any meaningful results. Just the other week, he sent me a picture of him fly fishing and also one of him kayaking as kind of a celebration because it was the first time in probably a decade plus he said that he could do those kind of things. Really worked on fixing the parts and pieces that were putting too much pressure on certain elements of his neck. That involves stretching what's tight, strengthening what's weak, and mobilizing what's stiff, and then working on more complex compound movement patterns that allowed him to get back to the things that he loves doing. Super good to see this review, see those pictures, makes me really, really happy. Let's go through a Google review and a case study of a patient of mine dealing with neck pain, cervicogenic dizziness, a lot of visual dependence as well. She'd been having mild low-grade neck pain for a long time. She could tell her floating dizziness got worse when it was irritated with sitting, lifting. She was also having a lot of dizziness and symptoms with visual environments such as driving, going to busy grocery stores, or even being stressed at work and trying to kind of focus on the computer screen. It was really impacting her day-to-day life, and she has a young son who she wanted to be able to do stuff with, wanted to be able to run around, take care of him, have fun. So what we needed to do was fix the primary causes of dizziness, which were cervicogenic dizziness, maybe a little mild hypofunction, and then work on the visual dependence and sensory integration piece. Sounds confusing, but like she said, that's why we meet every week, go over the stuff that's confusing, and make sure you have that step-by-step plan to get results like this. And it's crazy. It can feel like a long time, but I think we're like 9 weeks into working together. After dealing with this for a few years, that's pretty dang good. Stoked to go through this Google review and case study to talk about what we did to get this person who we'll call LH back to feeling good. So when I met her, she's a very active lady, had 2 kids, worked on a farm, wanted to be able to be active, do stuff with her husband, with their kids, and also around the house and farm, but she was struggling to get pretty much any of that done without having severe dizziness, and the neck pain wasn't severe, but she could tell it was spiking alongside the dizziness. What we had to do was really slow everything down. She was a go, go, go kind of person, which is awesome. But when you're moving too much and you're not controlling your neck, that's gonna flare your cervicogenic dizziness and make you even more dependent on your vision, which makes driving and all that stuff even harder, which she was experiencing. It'd be a vicious cycle. You gotta slow things back down, take care of the cervicogenic dizziness, make sure you can do some grounding and get better at controlling your symptoms when they do flare up a little bit. And you can progress into kind of controlling and desensitizing yourself to the visual stimulus. Good news is she's back to living life. She's doing all the basics. We're still pushing, trying to get her stronger, back to working out.